Back now on Triad today, we have one of our returning champions, as they say on the game shows, one of our returning friends, that is. Lori Bates, our director, filling in for J. Paul today. If we can see Lorelei Elkins, she's, of course, regional program coordinator for Triad Air Awareness. Welcome back to the program, dear.
Thank you. Great to be here.
Excuse me while I cough. It must be something in the air, which brings me to, they're going to think I made that up. Which brings me to the topic of asthma and health and how health is affected by air quality and the whole thing. Now, I know you're not a medical doctor, but I'm going to put you on the spot anyway, because we've got to talk a little bit of medical stuff here. How common is asthma? I mean, how problematic are things like asthma and COPD, things that are affecting people's lungs around in this area? And then we're going to talk about air quality later.
Okay. Well, you know, I'm interested in the asthma equation because it's affected by air quality. And asthma happens to be very common in the country. It's the #1 chronic disease reported by the schools. I think 93,000 children in North Carolina are reported at having asthma.
I didn't realize that much.
Yeah, it's about 900,000, including the adults in North Carolina alone. It's the #1 reason why kids miss school. It's the #1 reason why parents miss work to care for their asthmatic children and whatnot.
Gosh.
Yeah, and it's a very serious chronic disease. Of course, asthma triggers can be things like pollen, outdoor air quality issues when the air quality gets worse, and also some indoor air triggers like dust mites. You hear about that a little bit more often.
Dust mites, yeah.
Dust mites,
but getting back to the
smoke.
pollen thing, I mean, this has been is it my imagination, or have the past couple of months been horrendous on those of us that are sensitive to pollen?
Yeah, our office recorded some of the highest pollen readings that we've ever had.
I mean, I was physically ill. I mean, I didn't miss work, but I was just physically, I mean, had headaches and just the whole thing.
Yeah, quite a few people did miss work, even in our office, for pollen-related issues. And
you think you're getting the flu, or you don't know what's going on? I mean, it just has such an overall effect on you.
So imagine if you were sensitive to air quality issues and have asthma on top of that, you know, just the regular allergy issue, then you're one of these people who are having a very difficult time.
Well, now what should we do about this? I mean, people say, well, okay, Lorelei, thanks for being sympathetic to those of us that have asthma, and we know you care about air quality. But I mean, what's the short-term and long-range solutions for all this?
Well, there's, if you have asthma, typically you know it and you know what to do about it. But if you don't and you suspect you have asthma, or your children, then you should really get to your doctor, because it can be a life-threatening illness. And you need to have an asthma plan. And your asthma plan, you need to follow that when the air quality is bad, when you know what your triggers are for the asthma. Like, you know, if your triggers is dust mites, then you have to do something about the dust mites in your house, and they're very common, or pets. Any of these triggers, you need to have an asthma
Sometimes
plan.
pet allergies can then trigger it,
Pet allergies can trigger it. And you need to know what that air quality code is. And there's my pitch for my program. But
exactly.
Know what the code is on when the air quality is bad.
How do you know what the code is? Because I've talked about this before. I mean, there are phone numbers and things you can call, there are websites. We're going to put up some websites in a minute. But what's an easy way to know right now? I need to know right now, what is the air quality?
Go to triadair.org.
Okay.
And just click on the air quality index symbol.
Triadair.org. We'll put that up again in just a second. Now, you mentioned about people missing work, missing school. I'm assuming there's a big economic impact to people having asthma, going out when they shouldn't in these bad air days and whatever. Does that affect all of us in terms of economy?
Oh, absolutely. There's billions of dollars across the country are spent on direct costs, like medical costs for going to the ER. And there's also the indirect costs of the hours. Well, the schools don't get the funding when the kids aren't there, and the parents lost work hours. So these are some significant financial burdens on the community as a whole.
And as far as air quality, we've talked about pollen, but let's not forget there's pollution from cars and buses and trucks, and one way to cut down on that, talking about getting a plug-in, I always like to get a plug-in. You can ride the park bus, and that helps because you're putting your car and your truck aside for that day or that week throughout the year to get to work or go shopping, whatever. So look at that. Speaking of park, let's put up a couple websites. One is www.partnc.org. It has bus schedules and all sorts of information about the environment, which will also take you to www.triadair.org and find out more about what Lorelei was talking about. Thanks for doing that.
Thank you.
Good breathing to you.